7:21 in Trinidad and Tobago. Well, today is our fourth and final episode of our Eye Health Awareness series with Caribbean Vitreous and Retina Surgery Limited and Trinidad Eye Hospital. They have a month-long series of activities for free diabetic eye screening, and that particular program, the focus of much of our interview, that's what we're going to be talking quite a bit about during the course of our discussion this morning. There will also be a giveaway during this segment, so you may want to pay attention to the details during the interview. What is the connection to diabetes and the health of our eyes? Well, to give us some context, we are going to be joined now by two guests. Before I introduce them, as we're watching the video as well, with all of this important information, a lot of this is going to be relevant to the question that we were going to ask. So don't call in as yet, but call in when we cue you, because we're going to ask the question, and then we're going to have a giveaway for one person, a free glasses test for two family members for the successful caller. So you could look forward to that as we continue to provide you with the information via the video as well. And we want to thank the organization Caribbean Vitreous and Retina Surgery Limited and Trinidad Eye Hospital for their participation on our program with this particular awareness effort. So let's say good morning to our two guests. Lazarus, the program manager of the Diabetic Eye Screening Program at Caribbean Vitreous and Retina Surgery Limited. And also with us is Dr. Vineeth Kumar, consultant ophthalmologist with the same organization. Good morning to you both. Thanks very much for joining us. So let's begin, and again we want to ensure that if you want to win the giveaway and the testing, the free testing that is going to take place, the free glasses test for two of your family members for one successful caller, you have to listen very carefully to what we're going to present this morning. Let's start with Dr. Kumar, and the obvious question: how can diabetes affect your eyes, Dr. Kumar?
Good morning to all our viewers in Trinidad and Tobago. A very good question, Fazir. Diabetes, as most persons who suffer with it understand, that there is elevated blood sugar. When there is elevated blood sugar, it damages blood vessels throughout our body. And we have small little blood vessels. And these blood vessels, I'm just going to use this, is at the back of our eyes. And when these blood vessels start getting affected because of elevated blood sugar, which has been there continuously for a long time, nobody sees it. What we have now is a system where we take a photo through the front of the eyes to take a picture of the back, which will detect some of this damage that has happened at the back of the eyes. And that is the particular problem that happens with diabetics, where little changes start happening in the blood vessels at the back of the eyes.
Right. So let's bring in Ms. Lazarus as the program manager for the Diabetic Eye Screening Program, very relevant. And we know there's a lot of collaboration with those engaged in dealing with issues related to diabetes, one of those being the Diabetes Association of Trinidad and Tobago. Tell us about that partnership between the Eye Hospital and the Diabetes Association for this particular month, Diabetes Awareness Month. Good morning to you, Ms. Lazarus.
Good morning everyone. So this would be our second year doing this nationwide eye screening event with the Diabetes Association. So we will be going throughout Trinidad and Tobago during the month. The locations, you can look on our social media and you'll be able to find where it will be. The whole purpose of this screening is to help identify the diabetic changes going on in the eyes, hopefully early enough that we can intervene and help save sight. Basically, that's our mission.
And we're having a little challenge with the audio, sounding a bit hollow, Ms. Lazarus. But okay. Let's hope that we could get it sorted out. But we were able to hear you clearly, and we have certainly a few more questions for you as well. But let's go back to Dr. Kumar as we go through the process of providing you with the vital information. Dr. Kumar, what are the preventative measures persons with diabetes can take to preserve their vision?
Again, a wonderful question, Fazir. As I said earlier on, diabetes causes changes to the blood vessels at the back of the eyes. And the biggest problem that we find is that this can lead, if undetected, to blindness. So the first thing somebody can do to take care of themselves is making sure that they have checked their diabetes regularly, keep a complete monitoring of that with keeping the blood sugar stable along with the support of their doctor, ensure that the diet is good, exercise is regular, and get their eyes checked with our eye screening program or their eye care provider every year annually, because diabetes does not cause problems at the back. It can contribute to cataract, glaucoma, and other damages to the back of the eyes. So the prevention is largely what we have learned from studies is by keeping your blood sugars stable, blood pressure stable, and your cholesterol level stable. Those are the three parameters which need to be taken care of.
And so important to get those parameters clearly established with the help of our guest this morning. So let's return to Ms. Lazarus now. Tell us about the outreach work going on, Ms. Lazarus, in relation to eye health during this month of November, of course, which is Diabetes Awareness Month. Tell us about the outreach work.
Okay, so today, for example, we'll be at the Diabetic Association's headquarters in Chaguanas. We'll be moving throughout south, east, west, everywhere north of Trinidad, and we'll be heading to Tobago towards the end of November for 2 days to do some screening there as well. So our hope is to cover as much area as possible to reach as many people as we can.
And going back to Dr. Kumar, and we talk about the specific issues related to the complications to eyesight and eye health caused by the diabetes. What are the steps in the process for diabetic eye screening of patients, and what are the benefits of having that process done?
The first thing that we encourage every person who is a diabetic is to get their eye screened. So when they come to our eye screening program, this is what happens. We take some information of their medical history, get to know about what is going on with them. And in the process of the eye screening, the first thing we do is check their vision and then put some drops to make their pupils slightly large to allow our camera to pick up pictures taken by our team headed by Leanne and Basti, supporting them. And once we take pictures at the back of the eyes, these pictures are what we call as graded by our certified graders, and their grading will tell if the person has got no retinopathy change or has got some retinopathy which needs referral to the hospital. When they have no retinopathy change at the back of the eyes, they are given an appointment to come back and see in 12 months' time. But if they have some problem at the back of the eyes, what we recommend is to be seen by their doctor at the earliest possible, so that treatment could be initiated to prevent blindness.
Very important to get that information indeed. And before we present our question, and we'll give everyone the opportunity to call in, and of course the first correct answer will win a free glasses test for 2 family members. For that successful caller, the number to call 623-1711, extension 1995. But we haven't put up we're putting up the numbers, but we haven't even posed the question as yet, so just be mindful of that, because I know people will be eager. But we do have it now on the screen, by the way. Name 2 ways that diabetes can affect your eyes. Name 2 ways that diabetes can affect your eyes. So you could probably start calling in at the moment, and our producer will field your calls. In the meantime, I'd just like to leave it with our 2 guests, Ms. Lazarus and Dr. Kumar, as your own final messages to our audience in relation to sharing information with the public regarding diabetes and eyesight. If I could start with you, Ms. Lazarus, as to what do you think the important message that you'd like to leave with our audience this morning, Ms. Lazarus?
Sure. So usually we hear a lot that my eyes are fine, I'm seeing well, I don't need to get a check. Diabetes, when you have changes, you might not notice anything wrong with your vision, but there may be a lot of things going on to the back of your eyes. If you're diabetic, it is very important that you check your eyes at least once a year. Whether you think you're seeing well or not, it's very, very important that you always check your eyes annually.
And before I go to Dr. Kumar, we have a caller on the line already from Port of Spain. So caller from Port of Spain, good to have you with us. So the question is, name 2 ways that diabetes can affect your eyes. Caller from Port of Spain, go ahead please.
Yes, good morning. two ways that it affects your
morning.
eye. One, as the doctor is saying, well, blindness, for one thing. And two, he explained that the capillaries, the veins at the back of the eyes is affected because of the high sugar level. This is my take on it.
All right, so blindness and capillaries affected. So you all are the judges, so you all need to tell me if that answer was satisfactory, Dr. Kumar?
Yeah, I think so.
Okay, so we have a winner. We have a winner.
Yeah,
we have a
you
winner,
have a
right,
winner.
right away. So caller from Port of Spain, don't go anywhere. Our producer will take the information. Congratulations to you that you've received free glasses test for 2 family members for that caller from Port of Spain. So it certainly looks as if our callers and our viewers are paying attention, Ms. Lazarus and Dr. Kumar. So Dr. Kumar, let me leave you with the final word as well and your final bit of advice in relation to this issue of diabetes and eyesight, Dr. Kumar.
I'm so happy that the viewer actually has listened to what we have been trying to speak about. And I concur with Leanne, and I would also add by saying that this is my sincere request and appeal to every person with diabetes. We understand that you all have a lot of challenges, and we are here to help you. So come forward, get your eyes screened once a year with us or with your eye care provider, because it would help us to understand what else is going on in the other parts of the body. And what we learn is that if changes are picked up very early, then you can preserve your eyesight and look after your health, which in my opinion is your wealth, for a very long period of time. So please come forward. Anybody over the age of 12, seek out your eye care provider, come to our eye screen program, and throughout the country in the month of November and through our clinics as well.
Okay, so the eyes are not just a window to the soul, but they're a window to your general health as well. So we want to thank you very much indeed.
Absolutely. If you can see things clearly, I think it makes a massive difference to your independence and your economic ability. There are so many things we can talk about, Vineeth. But for me, what I have seen in Trinidad, and in India and in England where I worked, is that the fact that once the blindness is affecting the eyes from diabetes, there's not a lot we can do. But screening has a massive impact in reducing blindness and also the general health of the person. So our emphasis is on screening. So everyone, we would want you to take the step forward, and we're here to support you.
Absolutely. Dr. Kumar, Ms. Lazarus, thank you very much indeed. And we want to thank Trinidad Eye Hospital and indeed Caribbean Vitreous and Retina Surgery Limited for their involvement with this 4-part series here on Morning Edition. And let's hope that people really benefit from all the information that would have been disseminated over the past 4 Fridays. Thank you very much once again for being with us this morning.
Thank you very much for having us, Vineeth and TV6.
Yes, thank you.
You're more than welcome indeed. And congratulations to our winner from Port of Spain as well. And reaching out to the organization, you can reach them at www.trinidadeyehospital.org and together with the number 2354834. Appropriately, I have to put on my glasses to see the numbers quite clearly in that regard. Although I don't think I'm on the in the area heading towards diabetes as yet, but continue to monitor that situation very carefully. 7:35 in Trinidad and Tobago. Let's see what we have for you as we go to the break. Here's a sunset captured in Longdonville. Our viewer says, our viewer who is Jerry Lynn says the sky was ablaze, and it certainly is with this image. And now for a sunrise from Honeymoon Savannah in Tunapuna, submitted by Claire. Another one of those hazy sunrises that tells us that there's still quite a bit of dust in the atmosphere, a bit of haze as well. And whether it's Sahara dust or volcanic ash from that volcano in the area of the Canary Islands off the coast of West Africa, in any way, it makes it a very hazy sunrise as we go to the break.